Good day, everyone. My name is Wendy Madidis, and our topic is about nursing care of family with a toddler. First is the nursing assessment of a toddler's growth and development. In here, dito na natin malalaman ang beginning ng physical growth ng bata, lalo na ang kanyang skill development. And dito rin madidescribe ng parents niya or may evaluate ng parents niya kung ano yung mga illnesses na pwedeng tumama sa toddler at this age. Next is the physical growth. In here, madi-differentiate natin ang physical growth sa weight nila, sa height, head circumference, and sa body mass index. Sa weight naman, it's either mas bumigat ang toddler or magaan siya. Sa height naman, usually kasi if ang both parents ng toddler is maliit, pwedeng ma-inherit ng toddler ang height ng kanyang parents. Sa head circumference naman, it's either lumaki ang kanyang ulo or nag-wide or nag-same lang ng size dati. Sa kanyang BMI naman, combination ito ng kanyang weight and height. Probably if, sabi ko nga kanina, if lumaki ba siya or tumangkad ba siya or mas gumaan or mas bumigat. Next is the body contour. In here naman, sinasabi dito na ang mga toddler daw is merong prominent abdomen. Although kaya nilang maglakad ng mabuti or straight, yung abdominal muscle nila sa loob is not yet strong. For example, halimbawa, nahulog sila, madaling mabali ang kanilang bones sa loob kasi nga masyadong fragile ito as for their age. Next is the body system. In here, it includes their respiration, their heart rate, blood pressure, their brain development, their respiratory system, and their stomach secretions. Sa respiration nila, it becomes slow slightly, pero continue pa rin ito, mainly abdominal. Sa heart rate naman nila, at it's shown in the slide, nag-slow ito into 110 to 90 beats per minute. Sa blood pressure naman nila, it increases about to 99/64 mmHg. Sa brain naman nila, nag-develop into 90% of its adult size. And sa respiratory system nila, merong low chance na magkaroon sila ng infection diseases. Sa stomach nila, it secretes ang secretion ng stomach nila nagiging acidic. Next is their teeth. Merong tumutubong 8 teeth, bagong teeth, kapag 2 years old na ang toddler. And dumadagdag yung 20 other teeth kapag 3 years old na sila. Connected din ito sa kanilang language development kasi if ang toddler is meron ng enough teeth, may chances na pwede na silang makabigkas ng mga simple words, for example, mama or papa, or even name of things like bags, ball, ganun sila kapag meron ng tumutubong mga ngipin sa kanila. Next is their developmental milestones. Sinasabi dito na ang toddler development is influenced by social contact. Ibig sabihin, na titrigger ito or nagsa-start ito if merong social contact ang mga toddlers sa ibang tao. For example, dinala sila ng kanyang parents sa park, and then yung toddler maraming nakikitang ibang tao or other children, and they had a social contact or pwedeng nakipaglaro ang bata, and dito may influence or magkakaroon ng chance na makadiscover ng new skill ang bata and maka-feel siya ng independence since meron siyang ibang nakasamang other people and mag-isa siyang nakihalubilo sa ibang tao. Next is the toddler's emotional development. Dito, this is very important actually kasi nga the toddlers are now changing and they are now having their ability to understand the world and how they relate to people. Ang mga toddlers kasi masyadong curious yan. And in here, nag-start na sila thinking kung paano sila makaka-relate sa mga bagay na nangyayari sa kanila, kung paano sila makaka-relate sa mga tao sa paligid nila. And they wanted to learn sa stage na to, and it is a very important stage, lalong-lalo na sa parents ng toddler.
Autonomy. This applies to the development of a sense of autonomy versus shame or doubt, which applies to 1 to 3 years olds. This time, toddlers were encouraged to explore to develop independence and confidence, while if it is overly restricted, they will feel shame and doubt. Socialization. They might be clingy at this period of time, but they like to interact with other people and socialize. They also can identify what is a boy or girl since they imitate on the actions that you do, since toddlers are naturally curious. Just beware of actions and words around the toddlers because they are observing you and imitates. At this time, it is a must to guide them and help them understand things. So, the play behavior means projecting the actions or any action they observe and see. Cognitive development. Stages of cognitive development, sensory motor, happens on 0 to 2 years olds. It says that coordination of senses with motor responses, sensory curiosity about the world. Toddlers are also described as little scientists since they have interest on discovering new things, actions, or even the result of the actions that they make. Planning and implementation for health promotion of a toddler and family. Toddler visits to the healthcare facilities for health maintenance visits and also the immunizations. So by visiting frequently, it's easily monitored and provide prevention and early detection if the child or toddler is sick. It's important to start planning and implementing health promotion for toddlers from their very early years. Early childhood is a crucial time for development and growth, and it's important to provide them with the necessary tools and resources to ensure their physical, emotional, and cognitive development. By planning and implementation of health promotion for toddlers can help in preventing health problems later in life and also provide them with a strong foundation for overall well-being. There are practical tips and ideas for implementing health promotion for toddlers. Number 1 is to start early from the very early years of a child's life. It's important to introduce healthy habits and practices to toddlers from a very early age, such as proper nutrition, physical activity, and good hygiene. The next one is to use age-appropriate strategies when planning and implementing health promotion for toddlers. It's important to use age-appropriate strategies that are easily understood and implemented by toddlers. For instance, using visual aids, play-based learning, and storytelling can be effective ways to teach toddlers healthy habits. The next one is involve parents and caregivers on planning and implementation of health promotion for toddlers. Must involve parents and caregivers as they play a crucial role in promoting health. Parents should set good examples for their toddlers by leading a healthy lifestyle and encourage them to adopt healthy habits. The next one is do regular checkups. By having regular checkups, it is an essential part of planning and implementation of health promotion for toddlers. Parents should ensure that their toddlers visit the doctor regularly and receive all necessary vaccinations and checkups. And the last one is encourage physical activity. It is also essential for overall health and development. Parents should encourage their toddlers to participate in age-appropriate physical activities such as running, jumping, stretching, or other basic physical activities appropriate for their toddler.
And the next is the promoting toddler safety. To promote the toddler safety, kailangan ng mga parents na isigurado na wala silang iniiwan na gamit like nakaka-poison sa mga baby. Like for example, mga sabon kung saan-saan nilalagay, dapat nilalagay yun sa tamang lalagyanan para hindi makuha ni baby at hindi niya ito makain. At yung mga coins, dapat di iniiwan kung saan-saan para sa safety ni babies. And next is the lead screening. The lead screening measure the level of lead in the blood through a blood test in the finger or vein. It is important to lead in toxin that is particularly dangerous for young children because of their small size and rapid growth and development. Next is the toddler nutrition. So dito naman is dapat ang mga bata is sinasanay na sila pinapakain ng mga masusustansyang pagkain para makasanayan na ito. Hindi yung saka pa sila pinapakain is matanda na. Kaya maraming mga bata ngayon na ayaw nila sa mga gulay. Kaya habang bata pa sila, tinuturuan na at sinasanay na sa mga masusustansyang kainin. Promoting toddler development in daily activities. A toddler new independent and developing abilities in self-care such as dressing, eating, and to a limited extent. Hygiene presents special challenges for parents. Learning how to promote autonomy yet maintain a safe and helpful environment should be a major goal for a family. Dressing. So, dito naman is dapat ang mga magulang ay hinahayaan nila ang kanilang anak na maging independent. Like kunwari sa pagpili ng kanilang damit, hayaan natin silang pumili ng kanilang damit at i-guide lamang ito. Kung nagkakamali pa sila ay turuan natin to ng paulit-ulit para kapag makasanayan nila ito is alam na nila ang tamang gawin. So, ang mga baby is nag-decrease yung sleep nila habang tumatanda sila. So, ang mga parents, kapag si baby is hindi masyado siya nakakatulog sa gabi, ang gawin nila is sa hapon, paglaruin nila ito and wag masyado siya patulugin sa hapon para sa gabi is mahimbing yung tulog niya at tuloy-tuloy. Next is bathing. So, ang mga bata ay habang maliit pa sila, dapat tinuturuan na sila ng perfect hygiene. Dahil kapag makasanayan nila ito is madadala na nila ito hanggang pagtanda. So habang baby pa sila is paliguan sila araw-araw at saka linis. Ipakita sa kanila at ituro sa kanila kung paano sila linisan. Dental care. So ang mga baby is madali pa masyado masira ang ngipin nila. Lalo kapag kumain sila masyado ng mga matatamis na pagkain. Kasi ang mga baby is mahilig sila masyado sa mga candy. So, ang mga parents dapat habang bata pa sila is tinuturuan na sila mag-toothbrush. Toilet training. So, ang mga toddler is mas maganda kung natitraining na sila sa pagto-toilet para habang bata pa sila is lalaman na nila kung paano ang pagpupupo sa tamang lugar at hindi na makales pa sa diaper and mas madisiplina din sila kung saan ang tamang pagpupupo at pag-ihi. Discipline. So, ang tamang pagdidisiplina sa ang mga bata ay dapat is kausapin lang sila ng maayos at pakinggan kung ano yung explanation nila. Huwag yung pinapalo sila agad at pinapagalitan ng hindi pa alam kung ano ang dahilan kung ba't nila nagawa yun. So, as a parents, dapat pakinggan nyo yung kwento ng anak nyo kung bakit nila nagawa yun at huwag pagalitan kung di kausapin ito ng maayos. Separation anxiety. So, ang mga toddler is kapag yung nakasanayan nila na tao is ayaw nila mawala sa paningin nila yan. Like kahit mag-CR lang yung nanay nila, iiyak talaga yan sila. Dahil akala nila is iniiwan sila. So, ang gawin dapat ng mother is magpaalam ng maayos sa anak na babalik din siya. At kung may bago siyang ipapakilala niya ng maayos yung bago niyang yaya or caregiver para maintindihan ng anak niya at para hindi niya hanapin yung nanay niya.
Concern of the family with toddler who has unique needs. It may be difficult for children with physical or mental disabilities to achieve a sense of autonomy or independence because they may never be totally independent. However, it is important for these children to develop as strong a sense of autonomy as possible so that they see themselves as independent and can work to become increasingly self-sufficient as they grow older. So, yung mga toddler natin na merong physical or mental disabilities is mahirapan talaga ma-achieve yung autonomy or yung independence because kailangan pa rin nila ng guide natin sa lahat ng mga gusto nilang gawin or then minsan is kailangan pa rin natin silang bigyan ng kagustuhan or freedom na gawin yung isang bagay pero i-guide pa rin natin sila para hindi nila ma-feel yung parang gina-restrict natin sila. At least kahit anong gawin nila is dapat i-guide pa rin natin sila para ma-fulfill or ma-satisfy man lang sila then ma-feel nila yung may freedom sila. Next is autism spectrum disorder. Autism spectrum disorder is a developmental disorder that is characterized by behavior, social, and communication challenges. It occurs in all cultural and socioeconomic groups as frequently as 1 in 88 children. It has been identified more in males than females. So, autism spectrum disorder has 4 variations. First is the Asperger's syndrome, which known as developmental disorder. Young people with Asperger's syndrome have a difficult time relating to others socially, and their behavior and thinking patterns can be rigid and repetitive. Next is the Rett syndrome. It is a rare genetic, neurological, and developmental disorder that affect the way the brain develops. This disorder causes a progressive loss of motor skills and language. Rett syndrome primarily affect females. Most babies with Rett syndrome seem to develop as expected for the first 6 months of life. The third is the childhood disintegrative disorder or the CDD, also known as Heller syndrome and disintegrative psychosis. It is a rare condition characterized by late onset or great or 3 years of age of developmental delays in language, social function, and motor skills. And the last one is the pervasive developmental disorder or PDD, now known as autism spectrum disorder or the ASD. It is characterized by delays in the development of social and communication skills. Parents may note symptoms as early as infancy, although the typical age of onset is by 3 years of age. When autism started, or kailan nagsisimula yung autism? So many children show symptoms of autism by 12 months to 18 months of age or earlier. Some early signs of autism include problem with eye contact, no response to his or her name, and experience difficulty interacting with playmates. So ASD or the autism spectrum disorder begins before the age of 3 years and can last throughout a person's life, although symptoms may improve over time. What causes of autism or kung ano yung dahilan? So studies indicate the rate of autism is rising. So ngayon is yung rate ng autism is tumataas. But causes are not well understood. Scientists have found rare gene changes or mutations as well as a small common genetic variations in people with autism, implying a genetic components. A growing area of research focuses on interactions of genetic and environmental factors. For example, a woman's exposure to harmful contaminants during pregnancy may trigger a genetic mutations leading to autism in her child. Nursing care of family with a preschool child. The next is the physical growth. A definite change in body contour occurs during the preschool years. The wide leg gait, prominent lordosis, and protuberant abdomen of the toddler change to slimmer, taller, and more childlike proportions. In general, a preschooler's growth gradually will begin to slow this year and in the subsequent ones, from about a 5 pounds or 2.3 kilogram and gain and about a 3 or 1/2 inch or 8-9 centimeter increase in height during the 3rd year and then decreasing to about 1 and 1/2 pounds or 2 kilogram and 2 1/2 inches or 6.4 centimeter during the 5th. Play. Preschoolers do not need many toys because, with an imagination more active than it will be at any other time in life, they enjoy games that use limitations, such as pretending they are a teacher, firefighter, or store clerk. At this stage, many preschoolers have imaginary friends, which often exist until children formally begin school. So, yung mga bata ngayon is hindi na masyado naglalaro ng mga toys. Mas nai-enjoy nila yung paglalaro sa labas or di kaya yung nagbabahay-bahayan sila, gumagawa sila ng kunwari bahay nila, and also naglalaro sila ng kunwari isa silang police or firefighters. Or minsan naglalaro sila ng kunwari yung kaibigan niya is siya yung student, then siya naman yung teacher. So kunwari is ginaturuan niya yung mga kaibigan niya, and also yung shadow nila is pinaglalaroan nila. Then na-amaze sila every nakikita nila ito kasi ang iniisip nila yung shadow na yun is kung ano yung ginagawa niya or kung ano yung ginamove niya is ginagawa rin nung shadow na yun. So yun, na-amaze sila doon. Emotional development. Children change a great deal in their ability to understand their world and how they relate to other people during the preschool years. Initiative. The developmental task for the preschool age child is to achieve a sense of initiative versus guilt. Children with a well-developed sense of initiative like to explore because they have discovered that learning new things is fun. Initiative leads to a sense of purpose and can help develop leadership skills. Failure results in guilt. Essentially, kids who don't develop initiative at this stage may become fearful of trying new things. When they do direct efforts towards something, they may feel that they are doing something wrong. Then next is the fantasy. Toddlers cannot differentiate between fantasy and reality. They believe cartoon characters they see on televisions are real. Preschoolers, however, begin to make these differentiations. They may become so engrossed in a fantasy role that they fear they are stuck in the fantasy and are no longer themselves. So, yung mga bata ngayon is very mahilig sila manood ng mga cartoon networks or yung mga pinapanood nila sa TV or sa mga gadgets nila sa YouTube. Yung mga Peppa Pig, Paw Patrol. So, one of the example is yung sa Paw Patrol is nagsasalita yung mga sasakyan and aso. Then, pag nakakita sila ng personal is hindi naman nagsasalita yung mga sasakyan or nagsasalita yung aso ng words talaga. So, doon pumapasok yung fantasy and reality. Then, yun, gina-differentiate nila kung yun, nagtataka sila kung then doon ginaisip nila yung pagkakaiba.
Gender role this part, 3 to 4 years old, aware na sila sa difference between male and female so that parents or guardian need nila isalamuha sa ibang tao or family member para ma-achieve nila ang socialization. Moral and spiritual development, children of preschool age, they determine right from wrong based on their parents. So dapat pag pinapangaralan mo sila, dapat explain mo din sa kanila kung bakit or kung anong rason. For example, kailangan mong maging mabait para marami kang maging kaibigan. Or wag kang mang-away ng kapwa-bata kasi masamang ugali yun ng isang bata. Dapat maging careful pa rin tayo sa lahat ng sasabihin kasi lahat ng sinasabi natin, natatandaan nila yan. Yung mga ganitong edad, 3 to 4 years old, kung ano yung nakikita nila or naririnig nila, parang ginagaya nila yan. Promoting preschooler safety. As preschoolers broaden their horizon, safety issues must also widen. By age 4, children may project an attitude of independence and the ability to take care of their own needs. So, dapat at the age of 4, alam na nila kung paano i-keep yung mga gamit nila. Sex education, as a parents or guardian, obligasyon nila ituro sa ganitong edad ng bata na dapat ang private part ay nakatago or hindi dapat makita in public kahit pa nakapatid mo or kamag-anak. So dapat in this age, aware na sila about sa private part. Choosing a preschool or childcare center, a school or childcare experience is helpful for preschoolers because peer exposure has a positive effect on social development. Children who are comfortable in a childcare center or preschool may approach elementary or primary school with more comfort and be ready to learn. So, dapat talaga encourage yung parents or guardian at the age of 3 to 4, kailangan na nila ipasok sa school yung bata. Concerns of the family with the preschooler with unique needs. Learning how to do things when you have physical or cognitive limitation can be very frustrating. A preschooler with a disability has a greater need for problem-solving skills than the average child, because even simple procedures such as eating or getting dressed can be difficult if their physical challenge limits the option. So, dapat as a parents, pag may ability naman yung bata na kaya naman subuan yung sarili niya or kaya niya din magdamit mag-isa, hayaan mo lang sila maging independent para matuto sila. Malalaman mo din naman kung hindi nila kayang isang bagay kasi hingi naman sa'yo ng tulong.
Thank you sa pakikinig. I hope na marami po kayong natutunan.